come on in. I'm Dr. Murmurs. Lovely to meet you today. I'll be doing your cranial nerve examination. Alright, I do need to take a couple of questions, if that's okay. Can you confirm your name and date of birth for me? Great. Okay, and I just want to check that the address, email, and mobile we have on file is correct for you. So, what's your first line of your address? Okay, email, zip code, and mobile. Perfect, honey, perfect. Okay, so is there any medical history that I need to know about? Do you have anything at all, or had something in the past? Right. And are you currently on any medications? Okay. No problem. Okay. Alright, and now do you want to tell me what happened? Like, why are you here? Oh no, really? You poor thing. Okay. You've had the concussion since? You mean check for concussion? Okay. But you just want to check and make sure there's no further damage to the cranial nerves. Of course, I mean, that's completely understandable. You're a little bit nervous. It's okay. Like, the procedures we're gonna do today are super relaxing. I think you'll find that you'll completely relax and relieve some of that stress. All we do is we do a series of tests looking at each of your nerves. So we look at your olfactory nerve for your sense of smell, your eyesight, we do hearing, touch, movement. It's all very relaxing and nice tests. There's nothing to worry about, and it's highly unlikely that you will have damaged them, so please don't stress about that. Okay, but we'll just make sure. Alright. Well, why don't you join me with some deep breaths just to help you calm you down. So just breathe in and out. Breathe in and out. And breathe in and out. There. Alright, I just want you to be as calm as possible because I am going to take your heart rate before we begin, okay? Just want to check everything is okay. Just going to lift up your top slightly. It might feel quite cold when I place this on your chest. Alright, just touching you on like that. Good. Okay. Right. begin with your smell test. We're going to use some premium quality essential oils, and we'll get you to see if you can recognize any of the scents. You don't need to tell me what the scent is exactly, but if you're able to describe what you can smell, that would be great. Okay. I'm just going to make sure that, they smell perfect. So your first ones, just breathe in and out, and in and out. What's your thoughts? Good. Peppermint indeed. Okay, let's try this one. Just take your time breathing in and out. What's your thoughts? Citrusy, any idea? Yes, it is sweet orange. I love that scent. Okay. Next one. What do you smell? It is indeed tea tree oil. I feel like that is one of the most easily recognizable scents for sure. Okay, next one. You should hopefully be able to tell this one too. So breathe in and out, and that's it. Vanilla, indeed. It's a gorgeous scent. Makes for some nice massage oils with vanilla and a mix of other ones. Okay, we're just gonna go a little bit harder. If you don't know what it is, just describe it for me, okay? So, what's this one? It's not lemon, but it's close. It's citrusy, so it's citronella. So put that out and stop the midges and mosquitoes from annoying you. Okay, we have, what's this one? It's okay. It's like a musky scent. Any ideas? It's alright. Sandalwood. So you did really well with the musk. Let's try this one. Breathe in and out. In and out. Yeah. Yeah. But you're not, okay. Well, it is patchouli, so you did get that floral. So that's absolutely fine. I quite like these essential oils because it tells you different recipes here to make different types of fragrances, like for massage oils or for your diffuser. So they're really good and they're really strong, and different, so it's quite good for people like yourself that are wanting to come in and check to make sure your cranial nerves are working. But you did a great job. You correctly identified the fragrances, which is really important, and it shows me that your olfactory nerve is working the way that it should do. So I will make sure I note that down. Okay. Yeah, no problem at all. Okay. we're gonna move on to an ear test, okay? So I'm going to use a variety of triggers around your ears, and I want you to describe what you can hear. Okay, so we're gonna do that first, and then I'm gonna do a distraction test and make a sound and whisper something in your other ear, probably whisper a number, and then we'll do the tuning fork test as well. Okay. So first, so just describe what you can hear. Yeah, some beats on a pen. Good. What does this sound? It is a crunching sound. Indeed, so it's a little juggling ball, but it's the crunch that you can hear, so that's good. What about this? Against your ears. Does it sound like anything? What does the texture sound like? Sound soft? Yeah, it is a very soft little love heart pen. Okay. What does it sound like? Sounds like beads, yeah, so it's little pins. Very good though, very good. Let's see if we can have one more for you. Okay, what does this sound like? Sound like plastic with ridges. I mean, it pretty much is plastic with ridges. Very good. Okay, we're gonna do the distraction test now. So I'm gonna distract in one ear, and then I'm gonna whisper something in your other ear. Okay. So it's gonna be a number. You just need to repeat it back to me. do this 3 times and you just need to let me know if you can no longer hear it, okay? Great, next one. Great. Alright, we're gonna move on to your eye test today. So, if you can just look up for me. And down. And to your right. And to your left. Back up for me. And down. To your right. To your left. Okay, if you can just look at my finger. I'm just gonna check your pupils. Can you just follow my pen all the way in and out and in and out. Good. Okay, I'm going to cover one of your eyes. I'm then going to bring my fingers into different quadrants of your eyes. You're going to focus on my shoulder. And you need to tell me when you can see my fingers, okay? So we'll cover your right eye to begin with. Focus on my shoulder. Okay. Okay. Other side. Great. Okay. What number can you see here? And what number is this? Yeah, it's 9. What letter is this? And what shape is this? Great. Okay, I'm gonna hold this back here. I want you to read each letter for me, okay, from the beginning. E, L, D, F, P, H, O, L, C, F, D, H, J, B, S, E, P, T, Z, O, C, F, D, H, J, and L, T, F, P, H. Excellent job. You did really well there. Okay. Very well indeed. So both your eye test and your ear test. Yeah, I'm very happy. You've got quite a lot of cranial nerves involved in both. Vestibular cochlear is mainly your ear test, but oh dear, it's a little phone call. Alright, we're gonna move on to the touch test now. Okay, so just going to gently we're going to touch different quadrants of your face, okay? And I'm going to use this soft, and then I'm going to use the pinprick one, okay? And we'll do the soft one first. And you need to let me know if it feels different in your face or if there's anything you can't feel. And then we'll do the same with the pinprick. It won't be sore. Okay. Be nice and gentle. Okay. So. Same thing. Okay, did any of that feel different at all? Okay. Good. All good here. Okay, and then our final test is the movement test. So we're gonna look at your facial nerve first. So if you can raise your eyebrows for me. Good. Then squeeze your eyes shut. Okay. Wrinkle your nose. Okay. Smile widely. A bad smile. And then blow out your cheeks. Good. I'm just looking to see for symmetry. Now can you do it again? So I'm going to put some pressure on there. So try and raise your eyebrows. Good. I'm going to try and keep your eyes open. Try and squeeze your eyes shut. Good. Try and wrinkle your nose. I'm just going to put a bit of pressure there. Good. I'm just going to try and pinch your mouth shut. Try and smile. Good. And try and blow your cheeks out against my hands. Great. I could feel the muscles working there, so that was great. I'm going to put my hand here on your shoulders. I want you to shrug your shoulders. Yeah, get the resistance, that's it. Good. Okay, I'm going to put my hand here, and I want you to try and turn your head towards the right side. That's it. That's my hand. Yeah, that's it. Okay, and the other side. Excellent. Okay. Wonderful indeed. Okay, I want you to open your mouth for me. I'm just going to have a quick look in there. Okay, you stick your tongue out. And then can you tongue out to side? Great. No wasting on there. Alright. Okay, that was all good as well. So, you'll be pleased to know that this is all looking really great. Yes. There's not an issue at all with your cranial nerves. Yeah, your cranial nerves are absolutely fine. Alright. If anything changes, if your vision changes, if you get any visual disturbances, any additional floaters, if you feel like some of your muscles are not working as well, if you notice any asymmetrical movements when you're making facial expressions, and your hearing perhaps doesn't work out as well, do let us know and come back and see us. But aside from that, you have done an excellent job today. So thank you for coming coming in to see us, and I will see you some point soon.